Hi, I'm Lizzie. I'm one of the trauma and orthopaedic physiotherapists here at Ysbyty Gwynedd. I'll be seeing you before and after your joint replacement surgery. I'm here today to talk through the exercise guides that we will be going through with you following your joint surgery. So these are the sheets that we'll give you specific to your knee or hip replacement. These exercises are really important for the outcome of your new joint. So we're going to be aiming to do these exercises 4 to 5 times a day, and you can build it up gradually on discharge. It's really important you don't just do them when you're in hospital here with us. You follow it up when you're at home, and you build yourself back up to your normal activity level. Okay. Ideally, these exercises would be great if you could start them before coming in for surgery. That means that you get your head around what you needed to do and you get those muscles stronger. This will mean a better, faster recovery. So I'm going to go through the hip replacement exercises now. So this is the piece of paper that we'll give you when you come onto the ward. You're going to aim to do these exercises about 4 to 5 times a day. Okay, so I'm going to go through the front page now. So we'll start with ankle pump. So all that is just moving your foot up and down. Nice. Good. And that just gets these calf muscles pumping, gets the blood flowing. All right. These are quite easy. You can do these throughout the day when you're sitting, lying. There's no limit to how many you do. All right. The next exercise is inner range quad, so that gets these big quad muscles working. So what you're going to do is you're going to push the back of your knee into the bed. You're going to firm up these muscles so you'll feel them go a bit firmer. And sometimes you'll feel that the kind of heel just wants to come off the bed a little bit, okay? And you're going to hold those for 5 seconds, so hold that, and then you're going to relax. Okay, so you can see there's only a little movement. And again, good. All right. And the next exercise is called straight leg raise, so similar. Make sure you're lying down flat for these exercises, just so that you're staying in line with the hip precautions, okay? So you're going to push the back of your knee into the bed, activate these quadriceps, and then lift your heel a few inches off the bed. Good. And down. And again, just bring your heel a few more inches up. There you go. All right, and down. It's quite a hard exercise. It's one that you're just going to want to work towards, building up to about 10 repetitions. Okay. Then the next exercise is about getting that knee bending and that hip bending. Okay. So remember, with the hip precautions, you're not going past 90 degrees with the hip bend, so you need to be flat for this exercise. So what you're going to do is you're just going to bend your knee up, Wendy, and you're going to slide your heel back. Good. Just as far as comfortable, and then you're going to straighten your leg out again. And again, you're going to build up these repetitions. You probably start with 5, build up to about 10. Okay, do that one again. If you are struggling with this one, what you can do, you can practice with you on the ward, is get a plastic bag and just put that under your foot, like so. There you go. And then you just push your heel and bring your knee up. Good. And it'll just help the foot slide a bit easier, okay? So these are the exercises on the front page of the hip exercises plan. Okay. So this next exercise is a glute activation. So you want to be in lying, but you can also do this exercise in sitting. And all you're going to do is you're going to squeeze your bum muscles together. This works the glute muscles, and that works to pack your new hip joint in. So it's a really important one. So all you're going to do is you're just going to squeeze your bum cheeks together, feel them tense. You're going to hold it for 5 seconds and relax. And again, you're going to squeeze your bum cheeks and relax. And you're aiming to do 10 repetitions of this exercise. So now we're going to go through the standing exercises following your hip replacement. These are really important, and we'll go through them with you on the ward before you go home. So first of all, it's a 1-leg march on your exercise sheet. So you're going to stand holding something sturdy, like the back of a chair or a sturdy worktop at home. And you're going to bring your knee upwards like a march and down. Okay, and again. So you want to be doing this with your operated side to start. As it gets more easy, you might want to do it on both sides. Just depends on your confidence levels. Okay. You're aiming to do 10 repetitions of this one. Okay. Next exercise. So again, still holding something sturdy. It's called standing hip extension. So you want to keep your back nice and straight, and the movement's got to come from your hip. So this one will activate the glute muscles here. Like I said earlier, those muscles will work to pack that new hip joint in. So you're going to extend your leg back and bring it back in. It's not a big movement. Good. And you're aiming to do 10 repetitions of this exercise. It might get easier with time, you might get a bit more movement as you go along, okay? The next one is called standing hip abduction. So if you turn to the side, Wendy, facing this way, yeah. So this one is when the leg comes out to the side, again working on those glute muscles. So you're still holding on to something sturdy, and you're going to bring that leg just out to the side, good, and back in. And you're aiming to do 10 repetitions. Again, not a big movement. Okay, and then the last standing exercise, if you turn, sorry, to face the chair, it's standing knee flexion. So what you're going to do here is you're going to bring your heel up towards your bottom and you're going to bend your knee. Good. And this one works these hamstring muscles. You can bring it back down. Good. And again. You can hold it there for 5 seconds if you're able to, and it'll just really work these muscles, and then back down. Okay, and like I said, as your confidence develops, you might want to start doing them on both legs, but until you're confident on one side, just keep to the operated side.